Learning and practicing dance phrases with and without a mirror, a comparison study. Mirrors are commonplace in dance studios. Both dance teachers and students alike don't question their presence as a part of the dance studio. Mirror therapy has been used in the rehabilitation process for many conditions, including stroke, hemiparesis, and phantom limb pain. There has been a significant amount of research covering the effectiveness of this form of therapy on a myriad of conditions, as well as what happens in the brain as a response. Mirror visual feedback provides the individual with concurrent visual information, which can be helpful when learning motor skills. No research has been conducted to investigate at which phase of the learning process a mirror is most effective for learning, the demonstration and explanation phase, or the practice phase. The research that has been conducted on the use of mirrors in motor learning has had mixed results, and this could be due to the age or experience level of the participant or the exercise that was selected to be examined as a part of the study. The purpose of this study was to determine at which phase of learning a mirror is most effective as it relates to the learning and retention of a dance movement phrase, and at the demonstration and explanation stage of learning or at the practice stage. The study included 20 participants from Iowa State University with at least 2 years of dance training and a minimum of 1 year in either ballet or modern dance technique. All participants were 18 years of age or older and had not sustained an injury in the previous 6 months. The study included 3 sessions. The first session, participants learned a 32-count phrase of movement. At the second session, they practiced that movement phrase, and at the third session, they performed that movement phrase. Participants were broken up into 3 groups. The first group had the mirror present during the demonstration phase and practiced without the mirror present. The second group had no mirror during the demonstration phase and practiced with the mirror. The third group had the mirror present for both the demonstration and the practice phases. All 3 groups performed without the mirror present and individually, at which time video was taken of their performance. And this video was then examined by 4 external evaluators that were dance teachers and were scored on the number of errors in accuracy and timing. These scores were then evaluated using a Kruskal-Wallis test, and these results were not significant. However, the results showed Group 1, which had the mirrors present during the demonstration phase, to have the highest accuracy with an average error score of 1.49, while Group 2, which had the mirrors present during the practice phase, showed the best timing with an average timing score of 0.74 errors. Participants in Group 1 had more dance training experience with an average of 13.7 years. Than participants in Groups 2 or 3, and the additional amount of training experience was significant. These data suggest additional data is warranted in order to determine the effect of experience level and learning strategies used with and without the mirrors present. The research has indicated that younger or less experienced dancers have not yet developed the skills and strategies necessary to use the mirror as a tool, whereas older, more experienced dancers have developed those skills. They have also developed the strategies necessary to not be dependent on the mirror for constant feedback, and to instead develop a kinesthetic awareness so that they can use the mirror as a tool but not a dependency. The mirror can play a role in learning movement. The mirror can aid in neuroplasticity and enhance performance. Experience level may be a factor in developing the skills to use the mirror as a tool. Additional research is necessary in order to further elucidate this question. Using both visual input and kinesthetic awareness may provide better benefit to motor learning and accuracy of movement.